Our mental health care expert says a rush transfer of patients from Life Esidimeni was bound to cause chaos. Professor Pienaar says their care would be compromised, bringing about a level of anxiety and discomfort. Pienaar is currently under cross-examination in the inquest to determine who should be held criminally liable for the 144 deaths in 2016. Those people died of hunger and dehydration after being transferred to unlawful NGOs. SABC News senior reporter Griselda Lewis joins us live for more. Very good afternoon to you, Griselda.
Well, a very good afternoon to you, Nzinga. Indeed, that testimony by Professor Pienaar has wrapped up, and it's basically what we have been hearing consistently in this inquest, how the transfer of the mental health care patients was rushed and how they were compromised. Let's take a listen to what Professor Pienaar had to say earlier on.
Could that ever have been sufficient time?
In my judgment as a professional, for 2,000 patients, 6 months would be not sufficient in order to roll out the whole deinstitutionalization project. There was a compromise in time then if it took place only in 6 months for 2,000 patients.
So if a project of this nature is rushed, if I can refer to it as such.
Yes.
It, in all probability, I want to go as far as to say in all probability, but at least reasonably, it's to be expected it could result in a calamity. Am I correct?
It's a reasonable expectations, my lady. I concur with that. That when something is done too fast, it could create a chaos.
So Professor Pienaar also previously testifying how the transfer process was clearly marred by poor management of the patients' records, and that some of the patients had a dual diagnosis of diabetes and a stroke during that transfer period. But such information not being recorded in their transfer files. The inquest in Nzinga will resume on the 25th of this month, where another expert witness is expected to take the stand.
SABC News senior reporter Griselda Lewis there giving us an update. Thanks so much for your time.